Statistics released by the United States Agency for International Development, an independent agency of the United States federal government, states that health indicators in Nigeria are some of the worst in Africa. The statistics say the country has one of the fastest growing populations globally, and with 5.5 live births per woman and a population growth of 3.2% annually, it's estimated to reach 440 million people by 2050. With its rapidly growing population and developmental challenges, the country drags down the socio-economic indicators for the entire African continent. These indices, unfortunately, are likely to remain poor in the near future, especially as fallout of the severe insecurity in large parts of the country, as well as rampant poverty, continues. A not optimally functional regime of primary healthcare may be responsible in part for Nigeria's dismal health indices. Consequently, we shall be focusing on Nigeria's poor health indices, of course, the case for expanding the roles of pharmacists in primary healthcare with our guest, Dr. Teresa Pounds, who is a pharmacist and president of the Nigerian Association of Pharmacists and Pharmaceutical Scientists in the Americas. Dr. Teresa, thank you very much for joining us here. I mean, that reading, it does make for quite difficult reading, isn't it? We are such a huge population, and there's so much potential in this country, but the areas in which we lag behind definitely have such a damning response. So when we look at our healthcare indices, what do you think first and foremost is the cause of that, and how do you think we can remedy that situation?
Well, my background is clinical pharmacy. And being a clinical pharmacist, I will speak to what the pharmacists can do in terms of this situation we're talking about. I think the first thing we need to look at is the fact that we have to look at the multidisciplinary team approach in taking care of our patients in the primary health care. Pharmacists can support the physicians, the nurses, in terms of providing the medication therapy for these patients. Pharmacists, if you look at the literature, the first discipline that any patient goes to that they're comfortable with is the pharmacist. So I think that utilizing the skills and the knowledge of the pharmacists and involving them in that team approach is probably one of the first things we need to look at,
So I'm sure you're aware that my colleague Steve is live for us in Abuja, and he has been listening along. Steve, I'll throw to you for your question.
Absolutely. Thank you, Adefemi. And thanks, Dr. Pounds. Let me present two questions, together. First, you mentioned about the aspect of medication therapy, and I'd like you to expand further how this affects, how this trickles down, how this works in the value chain as far as primary health care is concerned. I know that you've been part of a conference here, in Nigeria of pharmacists. One, what's your assessment in terms of your colleagues and how they are dealing with the challenges that come with, pharmacists being within the value chain of healthcare delivery? That's one. And then number two is the major challenge that people encounter. And I know that you will have heard of things like these in the Americas. Medications that people can't get off the counter abroad. You find a situation whereby relatives abroad would send messages to Nigeria, especially when it concerns antibiotics. And then they'll pack all those, not out of bad will, but just to assist, because over there you can get to just off the counter and purchase some of those things. And then they buy loads of antibiotics from Nigeria, send them abroad. People are basically prescribing for themselves because they feel, oh, I know what is wrong with me. Antibiotics will deal with it, but I can't get it to buy over there, and therefore they send messages down home so that they can sell to them. How much of a problem do you think that constitutes in the value chain of medical health care?
So I think, and thank you for bringing that point. First of all, let me start by saying that pharmacists are dedicated to the preservation and advancement of public health. So, I mean, it's well documented in the literature. And when we say they've dedicated, then what does that mean? What that means is that pharmacists can be involved as educators. They can educate the public on medication. But let me go back to the question you have about the medications and people self-medicating. That's my understanding of your question.
Yeah.
As a team approach,
Absolutely.
and everybody has their scope of practice, if we have it whereby the physicians are prescribing, I mean, they're the ones who are like diagnosing the patient and they're prescribing, then the pharmacist can support that team to ensure that whatever the physician has prescribed is dispensed accordingly. And they will make sure that the patient is educated on the medications. And pharmacists can also be involved in terms of the vaccine. If you look at what's going on all over the world, pharmacists are actively involved in vaccination. They're actively involved in terms of helping immunize patients on vaccination, storing of the medications adequately, educating the public about what type of vaccines, educating the physicians. So I think what we need to look at is what is actually happening here. We need to look at, number one, that team. We need to recognize that physicians, pharmacists, nurses are key disciplines when it comes to taking care of patients. And then we need to recognize the skills and the value that the pharmacists bring to the table when it comes to providing care to patients. We also need to look at what's going on in terms of the infrastructure. Infrastructure meaning the scope of practice. Who does what? Who diagnoses the patient, who prescribes, and what the pharmacist does in terms of dispensing. I think those are some key things we really need to look at. That I really want to stress home. Multidisciplinary team approach, everybody working together for the benefit of the patient. The patient is the center of the care. That should always be our focus. What is the right thing for the patient? And the disciplines all working together to ensure that, in their area of expertise, that we're providing that for the patient.
Do you think, Dr. Pounds, that there is the appetite to expand the roles to include the skills and expertise that pharmacists have? Because I'd imagine if we're calling for more inclusion, it implies that as it stands right now in Nigeria, there isn't that level of inclusion there. So with the powers that be, do you think that they have the appetite to want to bring in more pharmacists and leverage off of their skills for the betterment of patients here in Nigeria?
Well, I've been coming to Nigeria for the past 10, 12 years, and I would say that I'm very, very encouraged with what I've seen. I think it's there. I think the recognition is there. I think the key stakeholders are really realizing that they have to do what's best practice. What's best practice is what's happening everywhere else. That team approach to providing the care to the patient. So I think it's only a matter of time, and already I know there are some talks already by different key stakeholders to say, well, we need to see how we can use the diasporas to bring things here and kind of showcase and work with that. So in answer to your question, I think that will happen, and there are already signs of that happening. So it's a matter of ensuring that we keep on track. So I just want to stress that team approach, and of course, we also need to recognize that our pharmacists, we also need to give them tools for them to feel comfortable, to be able to provide at the best, of what their skills is to take care of the patient. That goes back to like competency, providing them adequate education in certain cases so that they can provide that support to the physician and the nurses. Yeah.
Thank you. Mm-hmm. Steve.
All right, Dr. Pounds. My next question is to ask, at a time that the question of brain drain is once again hitting the medical profession in Nigeria really hard. A lot of people are basically, trying to get better opportunities elsewhere, particularly for the doctors and the nurses. From your own experience and interactions with Nigeria and colleagues in Nigeria, do you think that that's also applies to pharmacists in Nigeria. And if you can take this with it, do we have sufficient pharmacists in Nigeria? I ask that because of the, if you like, the menace of those that often, are pejoratively referred to as chemists. Those that you will find usually in the rural communities where this primary health care is, basically needed. And you see that they're not regulated. It is not likely that they've got permission and licenses to operate. They're just chemists, small stores, selling, in most cases, maybe fake or expired drugs. So on the one hand, you have pharmacies that are not enough and could possibly be looking for better opportunities, like the doctors and the nurses. And then, on the other hand, the menace of the chemist, small kiosks here and there trying to dispense drugs, and nobody's sure of what they are dispensing. What are your thoughts on that, Dr. Pounds?
I think, again, the PCN, I think, is doing a great job here in Nigeria to address some of those issues, meaning to ensure that people who are actually involved in dispensing drugs are qualified, are knowledgeable, are competent. But we have to remember that whatever we're seeing here did not happen overnight. It's going to take a while to get things resolved. And I'm also proud to say that the key stakeholders here in Nigeria, PCM, PSN, Ministry of Health, they are recognizing that, they can utilize the resources of the Nigerians in the diaspora. I'm not at liberty to say in details something that is already in the works, but I'm sure we will see the impact very soon. So not only are they, the key stakeholders, aware that this is happening, but they also, like I said, utilizing the resources of the diasporas abroad. I think with constant vigilance, recognizing that this is happening, and then ensuring that our pharmacists are well educated, that we are, again, using best practice. For example, and when I say best practice, globally, in most of the countries where pharmacists are clinically involved, they have to go to what they call the residency training. So there's already talk to say, okay, maybe some of our pharmacists need to have additional training so that they can be more comfortable, to provide those clinical pharmacy services. So I think it's just going to take time, but I'm very hopeful. And I would say that from what I've seen, that we are moving in the right direction.
Just to buttress off of Steve's point there, he touched on the prevalence of fake medication in Nigeria, which is a huge issue. I'd imagine that pharmacists play a very vital role in making sure that people are aware of what drugs are counterfeit and what drugs people can't use. But I guess that's part and parcel of a bigger problem. Yes. Poverty. Lots of people go ahead and use counterfeit medicine because they are cheaper, easier to access. So when it comes to eradicating the prevalence and the exposure of fake drugs in Nigeria, what role do you think pharmacists can play in that?
Pharmacists, again, when you look at the literature, the first discipline that the patient goes to is a pharmacist. Pharmacists can play a key role. Number one, I know we have a very active organization here at NAFDAC, and again, they're doing what they have to do. Then pharmacists have to also ensure that they are getting the good drugs. So by actively being involved with patients, medication counseling, they are the final stop to when the patient gets their medication. So medication counseling, ensuring that they are getting the right medications, and again, being very knowledgeable and working actively with NAFDAC, I think they'll be able to kind of catch some of those things. But the key issue still is we also need to be ensuring that we bring in the right drugs. We also need to ensure that the medications that the patients are getting is being prescribed by the doctors. And when they're being prescribed, they're written on the prescription so that the pharmacist who is doing the final medication, we can review that medication and can ensure, that this is the right drug, this is the right dose, this is the right indication. So if we follow those proper steps, meaning physicians diagnose, they prescribe, the pharmacists dispense, and they review what the physicians have done. I think we'll be able to catch some of those things.
Okay, Adefemi, can I put in a quick one?
Of course you can.
All right, Dr. Pounds. I mean, you mentioned the aspect of the role of pharmacists, particularly in this era of COVID-19, and their role in, vaccination and things like that. I'd like to ask you, as a clinical pharmacist, vaccination, as you know, is still very low in this part of the world, Nigeria, like most parts of Africa. Not due to the fault of ours, but because of vaccine nationalism that is happening all around the world. So my question is, when people who probably are ready for vaccination get to primary health care centers, get to pharmacies, or to all the designated areas, even after they have registered, in 2-3 weeks, what you are told is that, Moderna is finished, it's only AstraZeneca that is available, AstraZeneca is finished, we haven't got anything. And people are worried, people are concerned. So in the absence of vaccines at this point, what do you think should be the role of pharmacists as a stopgap medical counseling when people say, I haven't got the vaccine, not because I don't want it, but because it's not my turn yet, I couldn't get. But then if I'm feeling, one way or the other, you're feeling feverish and it's not malaria and stuff like that, do you think that counseling plays a role in dealing with this scourge before we get to a level where 70% or 80% of the population will have been vaccinated?
Yeah, good point. The key thing is, what are some of the strategies we can put in place to ensure that we get our vaccination compliance rate to what it needs to be? And the other question would be, who are the disciplines who are involved to make that happen? Pharmacists, if you look at what's going on again globally, pharmacists can play a key role in ensuring that we bring up our vaccination rate to what it needs to be. Now, in answer to your question, in the absence, pharmacists can help also with the storage of the vaccination, ensuring that the stability issues have been addressed. I'm not quite sure in terms of availability of vaccine, what pharmacists can do in terms of, unless they're involved in research. But the key thing that they can do, though, is education. They are innovators, so they can educate the patients in terms of what type of vaccines are available, what are some of the side effects of the vaccine. If the patient comes to them and they've taken the vaccine and they have side effects, pharmacists can also be of help to kind of help educate them, and they can keep track of the different kind of records pertaining to the vaccine. So I still say that the key role will be educating the patient, helping with the storage of the vaccine, and being like an educator to say, okay, this is what you have available, And they can also be a resource to the patient to say, okay, maybe you can get the vaccine here, or this physician office has this vaccine. So they can be a resource in kind of guiding the patient to where they need to go. I'm not quite sure in terms of here in Nigeria. I know it's probably not going to be the same as in US. We have different types of vaccine in US. We have pharmacists who are actively vaccinating patients, in their community pharmacy, in the ambulatory care centers, primary health care centers. I think we're getting there here in Nigeria. But the point, I think the key point I will make is that here in Nigeria, the direction we're going, pharmacists, at least in the primary health care centers, can continue to be great educators, letting the patients know what kind of vaccines you have available, and I'm hoping that at some point we can also get it to where our pharmacists can start vaccinating, And I know there are some steps that have been in place. They're talking to like key stakeholders to see when that can happen. To me, I think that's going to be the key thing. If we can get up to the point that our pharmacists not only can be knowledgeable, continue to help educate the public in terms of vaccines, but if they can also help to start vaccinating patients.
Absolutely. And I think, as you said, there are definitely steps being made in that direction.
Yes.
Pharmacists being trained as immunizers. And as you said, during this COVID-19 pandemic, it would be great if pharmacists can also be the ones administering vaccines.
That's correct.
You'll be well aware that the Pharmacists Council of Nigeria, otherwise known as the PCN, has said that the current status of the nation's primary healthcare system had placed an overbearing burden on the shoulder of the private health sector.
Right.
What are your thoughts on that? Do you agree? Do you disagree?
Well, I think it depends on what you kind of look at it. One thing that I think that will kind of be helpful, though, is we need to just recognize that pharmacists in any kind of health sector, whether it's in the acute care, meaning hospital, whether it's in the primary health care, whether it's in the ambulatory, in the community, they are all clinical pharmacists. Clinical pharmacists meaning they have that clinical knowledge to be able to support the physician to take care of the patient, support the physician when it comes to medication therapy management. And key points of medication therapy management are, if a physician prescribes a medication, the pharmacist can support that physician to say, oh, this is the right medication, this is the right dose for the patient's kidney, for the patient's liver, and then can dispense it and counsel the patient. And if any issues come up, they will have that good communication line to call the physicians and say, this is what I see. I think that's the first thing. That's what you're calling that multidisciplinary team approach. Each discipline respecting each other. No. So I think we need to just ensure, and we also need to recognize that the pharmacists who are in the primary healthcare centers, if you look at the pharmacoeconomic of healthcare anywhere, we should be looking at cost-effective medication therapy management for patients. And not only medication therapy management, but also the cost of taking care of patients in the hospital. The pharmacists who are in the primary healthcare centers, who are in the community, those are the ones that ensure that these patients stay well. If they are well, they don't get admitted to the hospital. And then you decrease your cost that way. And then the pharmacists in the hospital work with the physicians, the nurses, to make sure that medication therapy management is appropriate, is cost effective, and they decrease the length of stay in the hospital. So when you're looking at economics, all those things, ensuring length of stay in the hospital is decreased, and also when the patient goes home and they're in the primary health care, you're also ensuring that they don't get readmitted. So it's a continual cycle, So I think it depends on which way you look at it. But again, I have to keep going back to what I'm saying, that multidisciplinary team approach, recognition of the expertise of each discipline, all three. And the key ones are the physician, pharmacists, and nurses, taking care of the patient and ensuring that, and always keeping in mind that the patient is the center of the care.
All right, well, I'll defer to my lovely colleague, Steve, in Abuja for our final question on this subject. Go ahead, Steve.
All right, thank you, Adefemi. Just a quick one, actually, and that's to ask Dr. Pounds. What two things will you recommend? I know that you have said kind words about the Pharmaceutical Association of Nigeria, but what key two things will you recommend in keeping those that we spend, the system spends a good amount of money to train from eloping, from going to Dubai, from going to the UK, from going to the Americas, after we've trained them, because the system does not seem to work well enough for them. What two key things would you recommend so that people who are trained there can at least stay here and work for the patients, basically?
Yeah, I think, again, like I mentioned, I've been coming to this country. Well, of course, I'm a Nigerian, so I've been coming to this country for the past 10, 12 years. And I will say, each time I come, there's improvement, at least in my field of training, which is pharmacy. I think my recommendation, I think we need to do a gap analysis. We need to find out, why are some of these people leaving? Of course, a lot of times you think it's probably better over there. Then when you come there, you see there are also some issues there. We need to look at what is actually the relationship between these key disciplines, physician, pharmacists, and nurses. Are they satisfied? Is there like a job satisfaction? Because job satisfaction comes from if you feel you're respected and you're recognized for what you do. So are the pharmacists, do they feel fulfilled? So we need to come up with ways to ensure that our pharmacists are feeling fulfilled as clinical pharmacists, that they have the resources to kind of get them to the position whereby they feel comfortable clinically. And I think we need to hear what the Ministry of Health has to say in terms of the healthcare. And then with them working with like the PCN and PSN to see how we can kind of address it. I think what I'm going back to again is one of the most frustrating things you hear from the pharmacists, at least when they come over there to the United States, and some of the pharmacists that I've encountered with, they would tell me, they say, oh, this doesn't happen in Nigeria. We are not allowed on the floors to round with the doctors, to round with the nurses, to talk to the patients. I mean, he said that they are really flabbergasted that this is happening. So the question is, why is it happening there and not happening here? And it's not happening here because we need to come up with a system to make sure that each discipline understands the value of the multidisciplinary team approach, mutual respect for everybody to providing care of the patient. So that's my idea, what I really do think we need to look at.
Dr. Teresa Pounds,
yes,
who is the president of the Pharmacists Association of the Americas, thank you very much for joining us on the morning show today.
Thank you.